All right, welcome back. Amber and I were looking through some of the things that were going on today. We saw this press release. There's a new mental health clinic opening up if you're in the Arden Hills area. It's called Thousand Branches Wellness. It'll be an outpatient resource center for people there in the North Metro. We saw that and it got us thinking, where are we with mental health resources in Minnesota, especially post COVID? Some of us are very close to this ourselves. Our family members are struggling, but it's something that we should all be talking about. So joining me now is Sue Abderholden. She is the executive director of NAMI and someone that we have been talking to for decades, really, about these issues. Sue, thank you for being with us. The National Alliance on Mental Illness, we want to reiterate, is NAMI. Help us understand the balance between those who need help right now and available resources. How deep is that divide?
It's a huge gap, and for a couple of reasons. One, frankly, is because we have a whole lot more people who are struggling with their mental health. So the rates of especially depression and anxiety have gone up, increased more than 10%. And so that's a huge increase. And so people are having trouble, frankly, finding a therapist, even things like day treatment. Of course, we know hospital beds are hard to come by. And so people are not getting, frankly, the early care that they need.
Have we made any progress? I remember post-COVID, a lot of people saying, I want my teenager to see someone, but there's a 6-month waiting list. Do you still hear those types of stories, or has it gotten any better?
We still hear that. We do have a good program in Minnesota called School-Linked Mental Health, where actually grants are given to community providers who then co-locate in the schools, which reduces a lot of barriers. Telehealth, of course, has also certainly helped. The other thing that we've seen is, for example, this summer at the State Fair, NAMI has a booth in the education building, and we ask a question, and they have to spin the wheel, especially kids, if they want to get a free pencil, right? And one of the things we asked is, so what do you do when you have big feelings? What do you do when you're really stressed? And a high percentage of kids talked about their breathing methods and started doing it. And the parents would actually look at us and be like, well, who taught you that? And so I think what we're seeing is schools are also teaching kids what I would call social emotional skills, kind of how do I get rid of stress? How do I deal with my big feelings in an appropriate way? And frankly, I was just really pleased to hear that so many kids knew how breathing in a certain way, right, could really help them.
Yeah, every generation has challenges with kids, but this one obviously with social media, and I mean they're in classes having to do drills for school shootings and things. I mean, these are issues that many of us didn't ever have to deal with within the schools. I mean, if someone has a child in the school system and that child needs help, where do they even start? Because it seems really overwhelming.
I would start with the school social worker, or the school counselor, saying what's available in our building. Sometimes the school social workers are actually able to provide some help in figuring out kind of what's going on and how to access resources. So that would certainly be a place that I would start. We have heard from schools that the number one concern is kids' mental health. They're seeing little kids, frankly, not show up for school. And you don't think about truancy with first and second graders, but their anxiety is so high, they literally can't get into the school building. So we know that is certainly an issue among the schools, but parents should, either in the school start with the school social worker or start with their pediatrician or family physician.
Yeah. Sue, you had brought up suicide a little earlier. As a culture, it seems like we are talking more openly about suicide. Is the stigma waning? Is that helping? And I don't want to de-emphasize the problem because clearly it's still a major problem.
People are talking about it more. And I think if there's any silver lining about COVID is that it opened up the door to talk about it, because so many people, even if it was only for a day or two, right, experience depression or anxiety, just worried about the future, things that we can't control. And so I think it is good that people are talking about it more. We see through the classes we provide on suicide prevention, more and more people wanting to learn what are the warning signs and what can I do. And I do think that the evolution of 988 has also helped. It's an easy number to remember. You can call it even if you're not in a full-blown crisis, right?
Yeah.
If you're just struggling with your mental health, you can call 988 and get help.
Yeah, and there's we'll put up that information at the end of this interview too. You can text if that's better for you as well. So 24/7, 365, such an important resource. Sue, you with NAMI are going to head to the legislature in a few months, try to rally support as you guys always do. So for you guys to be able to help the rest of us, what are your priorities?
A big thing, frankly, is funding. Mental health really depends on Medicaid, and Medicaid pays way too low. And that's why we've seen providers close and people drop out of the field, is because the payment rates are so low. So we need to increase them, particularly around like residential care and the psychiatric residential treatment facilities that actually Paul was talking about in the previous session, because the rates are so low they can't hire people to actually do this work. So that's really important. And then I would say kind of the early intervention. So making sure that every school has a school linked program so kids can access care. We have legalized cannabis, and we need to look at the impact in terms of increased rates of psychosis. So having those programs that provide the early intervention that can really make sure that the trajectory of that young person's life doesn't change a lot. And always looking at crisis services, of course, housing, workforce issues as well.
You and I could have an hour-long, 2-hour-long conversation. We haven't even scratched the surface. What I appreciate about you specifically, known you for a long time, and I tell people this story, there was one night, I think 9 o'clock at night, where I needed something, and I called your office phone thinking I was going to leave a voicemail, and you picked up. Your work is tireless. You've been doing this for a very long time, and people who put in that kind of effort always have kind of a why. So I'm just curious, what is your why? What keeps you doing this work?
One is because I have family members, so I know the impact of mental illness on both individuals and families. But, I talk to a lot of people who, like you, called into my office and sharing their story. And it really is impactful when you hear the struggles that people have to access the care that they need. And so it keeps me going. And I will say that I had a wonderful mentor who always said, if you look ahead and you see how far you need to go, you need to look behind you and see how far you've come. And we have made progress. We're just not there yet.
Yeah, a lot more to be done. A lot of people struggling. All right, well, we got to just keep talking about it, Sue. Thanks for being with us. We appreciate it. Sue Abderholden, Executive Director of NAMI. Thanks for being with us.